intervention study called MIND-IT trial. That did not show any increase in cardiovascular events in the therapy group, which means that if you actually treat them, I think the drug which was used in this case was maprodilate probably, or nepozodol, they actually did not cause any problem. So apparently it has been recommended that these drugs are probably safe in presence of cardiovascular disease. What kind of prescription you give if you get a patient of post-MI with depression?
Sertraline and escitalopram.
Sertraline and?
Sertraline and escitalopram.
SSRI.
SSRI, yes.
SSRI
study বেশি আছে গাড়ি
Escitalopram recently there is study that যেখানে 30 or 40 mg তে there is torsade complex and there is certain cardiac death.
and hypertension বলছে 20 মিলিগ্রাম
Actually 20 বেশি escitalopram
না
Escitalopram, the highest dose is 20. 30 শুধু obsession এতে দেয়া হবে। Depression এতে you never give
আবার ডিপ্রেশন আবার 20 এর উপরও স্টাডি এসেছে
But SSRI is supposed to be, fluoxetine may be supposed to be safe in cardiovascular practice. That is the
Fluoxetine, this difficulty is drug-drug interaction. Sertraline is much better so far the pharmacokinetic interaction is concerned. So for that reason, sertraline goes before fluoxetine because it affects the cytochrome enzymes much more. So that's why when we get a cardiac patient after infarction, first drug of choice is sertraline.
Correct. And that is, what is interesting is coming to your the data that we discussed earlier, that called SADHAR trial. It's interesting. SADHAR trial has clearly shown that sertraline antidepressant heart attack randomized trial has shown that the patients on therapy group has a better outcome vis-a-vis the placebo group. But there is a little snag in that trial. If you really read the actual paper, very interesting. This trial was a short-term use. If you continue the medication over a longer period of time, it loses. If you look at the curve, it is not diverging curve. It is actually beyond certain time, I think beyond about 2 years or something, there is a convergence. So if you read the paper, although the conclusion of the paper says that there is a better outcome, but if you actually read the paper, you find that the curve actually converging beyond certain period of time. So a short-term benefit is there, and the next group of doctors, which includes cardiologists and psychiatrists, they do not recommend to use this kind of drug for a longer period of time. The question is whether or not, if the patient requires antidepressive drug for a longer period of time, what we should do, I don't know. Because the data doesn't support, let's say this patient needs antidepressive drug for 5 years' time. Now, the sertraline actually does not show this, because this patient or today's patient who had angioplasty or maybe bypass surgery in 5 years' time is going to have another problem because the cardiovascular disease is progressive and it cannot be cured. He may need another angioplasty, he may need another bypass surgery or something else. Now, the same patient may also require antidepressant therapy, but there is no data that initial 2 years' time there will be benefit, but beyond that there is not much of benefit. Was there any other drug which can be helpful?
We have data on Sertraline also. Escitalopram data is
Long term, there is no harm if it is continued beyond 2 years. Supposing somebody needs antidepressant beyond 2 years, is there any additional increased cardiovascular effects if we continue sertraline beyond 2 years?
No, but the data says that the sertraline beyond 2 years may not be helpful.
May not be beneficial from the cardiovascular point of view, but
Correct.
it will not cause any adverse effect. If somebody needs antidepressants for
No. What I am saying that let us say if the patient is taking depression, one group sertraline and all cardiovascular drug. Another group of patients taking placebo and all cardiovascular drug. 2 years time, these first group has got they have got less hospitalization, they got a better compliance, they stopped smoking, they all those kinds of things better. On the other group, they did not quit smoking, their lifestyle modification did not change. So obviously they are getting more cardiovascular problem. But beyond 2 years time, as you move farther, suddenly after 2 years time, 3 years time, 4 years time, you find that the depression part is fine, but it's cardiovascular, whatever these things are, they still complaint. So the question is that whether or not any, because it is an evidence. We don't know what is going to happen in a single patient, but obviously in a large group of patients this is applicable. There is a data which says the CREATE trial has shown that if you use citalopram, that is probably effective because that has got a better benefit on a long-term basis. Any data on the citalopram?
Yes. Actually, most of the studies on SSRI are initially on sertraline, then on citalopram. Escitalopram data we don't have that much, but recently it is coming up, few data. But most of the studies are done with sertraline and citalopram. Stereoisomer is escitalopram, and recently you have got data, but again that dose has to be titrated. It should not go more than
beyond certain shelf.
Actually,
So
depression after heart attack যদি depression হয় যেটা দেখা গেছে যে at 6 months and 18 months the mortality is higher those who are post myocardial infarction
Yes.
depression.
Yeah.
So after that ওই জন্যই ওদের সার্টালিনের ওই সাইড এফেক্টটা 18 মাসের বেশি হয়।
that especially the depression is an independent risk factor directly linked with mortality. Absolutely, what Dr. Ghoshal says is absolutely right. Directly linked with mortality. Acute myocardial infarction, recovery, depression. 2 years time they are going to die more. No question about it. So that may be the reason that now if you give sertraline, they improve. So which essentially means that it is a kind of a phenomena which you are feeling that well this is the true. It is not. Because you need to now to find out the efficacy of sertraline is a short term benefit. Now, because you are taking up the depression. Now, beyond that time, the cardiovascular risk will be there. So, we need to work more sort of closely to find out a better antidepressive drug, an alternative antidepressive drug for the long-term benefit. Because another interesting observation, there is a study called WISE trial. Because women, after post-infarction or post-CABG, post-angioplasty, post-coronary artery disease patient, they found women with depression, if you give them an antidepressive drug, whatever may be the drug, they found they got a deleterious effect called WISE trial, Women Ischemic Syndrome Evaluation Trial. That is what it is. It's a great trial. This is only one trial. For some reason or other, these women, do you have got a more women patient or than men patient in the practice?
Depression definitely.
Women.
Depressive more.
Right. So the women they actually had a psychiatric consultation. And once they found that once they be prescribed on a long-term effect, they actually did not do well on a long-term basis. So that is a data which said, but again I think we need to have much more data to talk about it. But this is a simple knowledge we can share that whether women need a special attention, because we need to seriously consider, and I'm a strong advocate of this statement that women are not little men. They're a completely different group of individuals. We have to respect them in a different manner. They're not little men. So if they are not little men, their ischemic heart disease pattern is different. They don't get classical chest pain. Their character is different. Their risk profile different. Their presentation is different. So at the same time, their biochemical alteration during the cardiovascular event is different. And we have to respect that. We have to understand that, and we have to treat them accordingly. That is a very important component. So that is the data come from Women Ischemic Syndrome Evaluation. Now coming to antipsychotic drug and heart. Am I doing all right or?
Beautiful. This will bring up nicely.
So coming to antipsychotics and heart. Of course, you know the first generation antipsychotic drug like phenothiazine, all this chlorpromazine, the entire group of chlorpromazine particularly had a huge lot of cardiac